You're listening to the Doctor Is In podcast, brought to you by MartinClinic.com. During the episode, the doctors share a lot of information. As awesome as the info may be, it is not intended to diagnose, cure, treat, or prevent any disease. It's strictly for informational purposes.
Well, good morning, everyone. New studies out this week, and this one was rather interesting, okay? So one is on the birth control pill, and then on the other end of the spectrum is the study on testosterone, okay? New research on the birth control pill. So let's talk about a couple of studies that came out. New research, key area of the brain, the hypothalamus, shrinks in women on the birth control pill. Okay? Now, what do men know about birth control? Nothing. But I'm a hormone guy, so I'm very interested in this because I see all sorts of problems, okay? Look, I never tell a patient to get off the birth control pill. I don't. I never do that. I try and coach them through it with, changing things because a lot of people, I always ask this question with the birth control. First question I ask, are you taking that for birth control? Are you taking that, especially young ladies, you're taking it because the doctor put you on it because you had very bad periods, okay? Or, severe acne and, endometriosis or whatever. So they put you on the birth control pills so that your periods start to regulate. And again, I'm not telling you not to do that, okay? So please, okay? So what I'm saying is that this study just came out this week, okay? So this is hot off the press. That when you're on the birth control pill, your hypothalamus, okay, shrinks, okay? What's your hypothalamus, okay? Your thyroid don't work without the hypothalamus, okay? The hypothalamus is your hormone control center in your brain. Okay, so when you hear these big words, okay, let me just break them down for you. When you hear hypothalamus, okay, two things you have to remember in the brain. I make it easy. It's, I'm not a neurosurgeon. They would probably laugh at my simplicity, but it works for me and it'll work for you, okay? Okay, now, the hypothalamus in the brain is your control center. Remember, your thyroid, ladies, is just a puppet, okay? It's just a puppet. It can't work without the hypothalamus. And your estrogen, progesterone, coming out of your ovaries, they get their signals from the hypothalamus. That's in your brain. The birth control pill, according to this new study, it shrinks that area of the brain, the hypothalamus. So the hypothalamus is the control center of your hormones. So when you're uptight, what makes your adrenal glands secrete cortisol? The hypothalamus. So think of any hormone like that, it's the hypothalamus. You got it? The other area in your brain, so really two areas. Just think about these two and you got everything down. The other one is called your hippocampus. Okay? What is your hippocampus? Think of the word campus. University campus. College campus. That's your memory center. And, okay, let me just pontificate for a minute here. The hippocampus shrinks. That's your memory center. When does that shrink? When you have too much sugar. When you don't have enough B12. That is why guys, I know they're looking for a vaccine. I talked about it this week for dementia. It ain't gonna happen. Because dementia and Alzheimer's, which is the number 3 killer in North America, number 1 in the United Kingdom, it is affecting the hippocampus. It's insulin. It's sugar, primarily. Okay? That makes your brain shrink. And because people bought the lie that fat makes you fat, your hippocampus doesn't work without fat. Neither does your hypothalamus. But your hippocampus does not work without fat. So when people eat fat-free, first of all, they're not getting fat-soluble vitamins that are essential for the size of your hippocampus. Think of fat-soluble. Why do I always talk about fat-soluble vitamins? Vitamin D, vitamin K, vitamin A. Okay, why do I talk about those all the time? Because those are the most important vitamins. Okay? They're the fat-soluble vitamins. And then you got one water-soluble vitamin that is really important specifically for the brain. People are deficient in what soluble? What water-soluble vitamin? B12. So that affects the hippocampus. The hypothalamus is the hormone center. That's all you got to remember, guys. Okay? That's all you got to remember. Hippocampus, hypothalamus. The study was showing on the birth control pill. Okay? The birth control pill has side effects. Now, guys, listen. Don't come after me. Because you're mad at me, ladies. Okay? Because maybe your daughter, your granddaughter, or whatever, they're on the birth control pill. Okay? It's convenient, for birth control. And you got to understand, I always tell my patients, I'm on your side, okay? I'm on your side. But I have to warn you, you're on the birth control pill. One of the problems I see, okay, let me just give you, I know, and look, you just Google this. You don't have to get it from me. These are just facts, okay? The birth control pill, primarily the one that is they sold the most, is the one that, first of all birth control pills are made of horse's urine, okay? Horse's urine. They take the mare, woman, not the mayor of the city, but the mare, M-A-I-R-E, right? The mare, the woman horse, she's a mare, and they take her urine. That's how they make the birth control pill, okay? And they're giving you primarily, almost exclusively, estrogen from a horse. It's a horse, of course. I remember that because we used to, my little sister, we used to have the horse, and you pull the string and it said, I'm a horse, of course. Listen, this is where they get birth control pills. They give you estrogen, okay? From a horse. Now listen, the problem with that is you're not a horse, in case you didn't know. A friend of mine here, Dr. Fishman, what did he say? If you start eating hay, then you can take the birth control pill. He's a hormone guy, okay? He was one of the first guys ever come out with bioidentical hormones. And he's here in South Florida, and for years taught at Nova Medical School. He's a pharmacologist. And I used to laugh when he used to say that. He said, well, women that take the birth control pill, yeah, there's side effects to it because it's primarily estrogen. If you take the IUD, that's a device that gives you progesterone, okay? So, and I'm not saying not to do it, okay? So please, what can I tell you? Okay? What can I tell you? But here's the research, okay? So if you go Google it, just Google it, and you'll see that when you're the birth control pill, you're much more susceptible to breast cancer. You're much more susceptible to deep vein thrombosis, which is a blood clot in your arteries. It affects that. But now they're showing that it actually affects your hypothalamus. Your hypothalamus one of the big things, it gives high blood pressure too. I mean, just like I said, Google it. This is not Dr. Martin telling you this. This is, which is common knowledge. But it's so common today. But let me just tell you another thing that I see a lot of with the birth control pill. Look, if you took it temporarily, sort of to help fix your bad menses, I got no issue with it. The problem is when you stay on it for a long period of time. Women have oftentimes, they have a hot, then they want to have children. And guess what? For a lot of women, this has messed up their hormones so bad. And I think it has to do with what I'm just talking to you about this morning with the hypothalamus. It shrinks. And with the brain center shrinking, it can affect your thyroid. It can affect your adrenals. And so these are the type of things that at least, ladies, you should know about, okay? Your daughters should know about. Your granddaughters should know about. Because most people, it's amazing to me when people come in to see me at the office and I talk to them about hormones and I tell them what's going on with their hormones, and they said, well, nobody's ever told me that. Nobody ever told me that the reason I'm getting really bad periods and all that is because I got too much estrogen. And now they're giving me estrogen. So yeah, well, ladies, you don't get breast cancer unless you have too much estrogen. Talk about this all the time. Estrogen, estrogen, estrogen makes you a woman, but it makes you more susceptible to breast cancer because estrogen is a growth hormone. Think about it. It makes you a woman. It makes a man a woman too. And that's why I relate it to men. Like breast cancer and prostate cancer are almost identical cancers. Because for men, what makes the prostate grow, and we're going to talk about this in the second study more, is estrogen. A lot of men, when they hit their 45, 50 years old, they have more estrogen than their wives have. I'm not kidding you. It's craziness. So, that's all I'm saying. Okay? So, I'm not telling you not to take it. All I'm saying to you, if you take the birth control pill, then understand there's side effects. Understand, even in the brain now, they're showing changes in the brain with the birth control pill. So all I'm saying is this, minimize the side effects. If you're going to take it, I never let a patient get out of my office. If they are staying on the birth control pill, I tell them you've got to block that extra estrogen. Block it, because you're taking horse's urine estrogen. That's how the pills are made. It's synthetic. It's not even a natural hormone. They synthesize it. And they do it because they need a patent on it. They need a patent. And they can't patent what you can get in nature. So what do? They take this horse's urine and they synthesize it. And it's a synthetic hormone now. And look, again, I'm not saying never take it. I'm just telling you the side effects of it. Okay? So the side effects of estrogen are crazy. And I don't want you to have endometriosis. I don't want you to have polycystic ovarian disorder, where the ovaries are, your period comes, ladies, and you're bent in two, where you get acne like no tomorrow. But that's all due to an imbalance between estrogen and progesterone. Yeah. Because if your estrogen is too high, your testosterone, ladies, will go too high. And if you got hair on your chin, or you have a little bit of a mustache growing, and your skin is not good, this is an imbalance of hormones. And I want you to fix that. Absolutely. One of the things the reset does, okay? We've been talking about the reset in the since Monday, January 6th. We got over, I think, 12 or 1,300 people doing it. And one of the things that really helps is, one of the things the hormones do when you're out of balance is you get polycystic ovarian. You can get PMS and terrible PMS, and heavy menses. These are all things are irregular periods. This is an imbalance, guys. If you have any of those symptoms, that's imbalance. You're not balanced. Well, what I try and do in the office is balance your levels of estrogen and progesterone. Level them out between the two of them. And when you level that out, it's amazing how much better. And the diet does help. There isn't a doctor in the universe doesn't know that the diet of cutting back on sugars and that are helpful to hormones. If they don't know that, they should have learned that the first day in medical school. It does make a difference, right? Because they know with polycystic ovarian, PCOS, that it's insulin. They know that. They know it's insulin. They might not talk about it when you're in the office with them, but they know that's insulin. That's why a lot of times they'll put you on the birth control and metformin. What is metformin? It's for diabetes. Even though you're not a diabetic, they're trying to lower your insulin. And usually that's all they know. That they only know synthetic. They only know what the pharmaceutical tells them. They don't know any natural remedies. Most doctors, they don't know that stuff. They don't know about things that help to lower your estrogen, like DIM, D-I-M, that we use every day. One of our most popular products is DIM because I give it to women and I even give it to men when they're making too much estrogen. I give them the DIM. I dim them out. It's because it really makes a difference. I just want ranges. I don't care what the blood work says. That doesn't mean a thing to me. It doesn't. It's not. It doesn't show me anything because doctors never test them anyway. But all I'm saying is they need to be balanced. Estrogen makes you a woman. Progesterone is pro babies. And you need both. And you need them to be equal. And what happens in our day and age is that estrogen is always high. Why is estrogen high? Why is estrogen too high in this day and age? Because of a couple of things. One is our food. People, especially if you're a vegetarian or a vegan, you're eating too much stinking soy. Don't eat soy. And the environment, everything plastic, it's in the water. Estrogen is in the water. Estrogen they're called xenoestrogens. Everything, you go through your kitchen and all the cleaners and all the air fresheners, unless they're essential oils, but most people don't use that. I mean, they don't. They still clean with Mr. Clean and like different ones like that. And it's in your bathroom. Well, those are all, they make estrogen. Your body thinks those things are estrogen. It's in the food. It's in the food supply. You can't get away from it, guys. You're not gonna, what planet are you going to? I told you the story of a lady come in one day, and I mean it. She was leaving the world behind. She was 50 years old, I think, and she was going to Costa Rica for the rest of her life. And I said, it sucks to be the rest of us. What are you're gonna, and you know what? How does she know there's no xenoestrogens in Costa Rica? Right? They got plastic there too, I'm sure. You're gonna go and live on a little island in Costa Rica on your own? Okay? All I'm saying to you though, guys, all I'm saying to you is hormones have to be, okay? I tell it like it is, and I just can't help myself. I got the can't help it to tell you the truth. So again, ladies, it's all about balance. And your hypothalamus is shrinking if you've been on the birth control pill. How do you make it whole again? Eggs, meat, and cheese. Eggs, meat, and cheese. What does that do to the brain? It brings fat to the brain. You want to make your brain go whoop again? Because you know what Alzheimer's is? It shrinks. When they do autopsies on dementia, Alzheimer's, the brain is shriveled up like a prune. The memory center, the hippocampus, destroyed or almost destroyed. There's no fat. And here's another one. I talked about this the other day to the people on the reset, and I might have talked to you about this even last Thursday as we got ready for the reset, or Monday. I can't remember. And it's not my hippocampus because I can't remember. It's because I can't remember. I do so many videos, I can't remember what day I did them. I don't think that's a bad memory. I just can't tell you exactly what day. Why are you not eating eggs? Oh, the doctor said only have 1 or 2 eggs a week and you're going to get cholesterol. Oh, my blood pressure is going up again. Choline, choline, choline. All of your feel-good hormones, all of your neurotransmitters in your brain need choline. Guess where choline is found? Your hippocampus. It needs choline. Your hypothalamus, your hormone control center. Your brain's an electrical grid. You need choline, choline, choline. Where is choline found? Eggs, meat, and cheese. Highest form in the yolk, because I had a patient saying, oh, I only eat the egg whites. But my doctor said the cholesterol is found in the yolk. Yeah, it is. And cholesterol is good for you. You need cholesterol up in your brain. You don't need just choline, you need cholesterol. And cholesterol is only found in the animal kingdom. It's found in eggs. It's found in cheese. Cholesterol is found in meat. You need it. God don't trust you enough to eat all your cholesterol. I always say this to you. God don't trust you enough. 85% of your cholesterol is made in your liver because you can't live without it, guys. Okay? And they make cholesterol a boogeyman, just like the sun. Craziness. Craziness. Okay? So, what am I saying to you? Hormones, 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 ladies. Hormones. Do you got hormones? You'll always have hormones, by the way. I had a patient say, Doc, I'm praying for menopause. I said, be careful what you pray for. Because menopause, if your hormones are not balanced, you're going to start a whole pile of new symptoms. Ladies, you know that. I mean, there are women, the day they hit menopause, it's like somebody invaded their body. They get another body. They can't sleep, hot flashes, mood swings. You know what I'm saying? It's crazy, guys, because men, we don't get any of this. Men are big babies. If a man ever had a period, he'd go shoot himself. Okay? I'm just telling you the truth. We're the biggest babies ever. Are men. We couldn't have babies. God knew that. You know, we might have one and then we'd shoot ourselves. Like men and period. You couldn't give a man a period. We couldn't take it. You couldn't give a man PMS. He'd shoot himself. I'm serious. I'm a man. I know. Des gros bébés en français, I tell people. Okay? Ladies, you need hormones all the rest of your life. You don't want to have no estrogen. You don't want to cut your estrogen to nothing. You want to have nice skin? You need estrogen. You need estrogen. Estrogen keeps you young with progesterone. Progesterone is the youth, the anti-aging hormone. Isn't estrogen as much as it is progesterone. And all your other hormones, you need progesterone even to produce them. Progesterone, ladies, your master hormone isn't estrogen, it's progesterone. And because people look at me like I got two heads when I tell them that. Because they're thinking progesterone, pro-babies. What do I need that for? I'm not having a baby. Because your other hormone, progesterone is the great equalizer. Progesterone is what makes a woman feel good. Progesterone protects her skin. Progesterone is the one that protects her from cancer, breast cancer, ovarian cancer, uterine cancer. All those cancers are driven by estrogen. And estrogen only takes off when you don't have enough progesterone. Do you know, ladies, that even in your brain you need progesterone? You need that. That's what helps you not to let your brain shrink because of the use of the birth control pill, because it's estrogen. Again, I'm not saying you don't need estrogen. You need a balance between the two, okay? I remember when, I can't remember which one of my children were born. I was in the, I went in the room during the delivery with Rosie. And I love Dr. Hall. He's such a good doctor. He said, you better get him some help there. He's going to pass out. Rosie was a lot tougher than me, I can tell you that. Women are tough. Women are tough. Okay. I was going to get to the testosterone. I'll do that one again later. Okay. I'll do it at another podcast because a very interesting study came out on testosterone. Ladies, you need a little bit of testosterone, by the way. Yeah. Men need lots of it. You need a little bit. But what women need more than anything else is a balance between estrogen and progesterone. And progesterone is your master hormone, okay? How can you tell if you have too much progesterone? You don't. Never seen it. Never seen a case here. I've never seen a case of too much progesterone. Doesn't happen. No. Progesterone is it's a balancer. Your body will only try and produce more of it if your estrogen is out of whack. So it's estrogen that is the one that goes out of whack, not progesterone. Progesterone is good for you. I've never seen it. Okay? Is it different depending on your age? Yeah, it's different. Okay? But ladies, you know what? Here's what I see, okay? Here's what I see. I see a lot of young women that are so messed up hormonally. I mean, they got terrible periods, terrible skin. Well, let me give you an example of low levels of progesterone. A woman's had a baby. They leave all their progesterone in the placenta. That's normal. But do you know what postpartum depression is? Okay? Again, men never get postpartum depression. But women can after a baby. You know, a lot of times, like I'm a question guy. So when ladies come into the office, I go, well, when did all you get messed up? Now, some women, well, I've been messed up since I'm a little girl, the first time that I ever had a period. It was always bad. Okay, well, that was too much estrogen, not enough progesterone. But a lot of women happens after they have a baby. Maybe not the first one, second, third one. And they go, you know what? I was really good up until I had my third baby. Well, what happened? Well, you left all your progesterone in the placenta, and then guess what? Your ovaries weren't kicking in enough, so your estrogen takes off. And now you can have mood swings, you can have bad periods, irregular periods, or whatever. And then these are traumatic events, okay? In a woman's life, there's 3 traumatic events hormonally. The first day of ovulation, okay? Babies can be very traumatic. Now, it can fix. I've seen where women get pregnant and then after the baby, they never had another problem with their hormones. But a lot of times, they have big time problems, okay? So one, when they ovulate for the very first time, do you know that I get little girls in the office, 8 years old? Why is it? Well, think about it. All that crappy carbohydrates and sugars, and that messes them up. And then plus all the environmental estrogens that are and they're canaries in the coal mine, and they're right out of the gate terrible. Imagine at 8 years old or 10 years old. That's way too young. But now women are young girls are developing earlier than they ever used to. It's estrogen compared to progesterone. So the second traumatic event is babies. The third one is menopause. And for a lot of women, one of the things I see the most in the office is what I call perimenopause. It can start in the 20s. It is very common in the 30s in women. And what is that? Oh man, I don't feel good. I'm starting to get some hot flashes. my periods aren't regular anymore. They used to be regular. And I said, well, you're into perimenopause, man. Again, it's an imbalance between estrogen and progesterone. Now, when you hit full menopause, because one of the things that we see is hysterectomies, right? Partial hysterectomies or total hysterectomies. Remember, if you're watching me today or listening to me today and you've had a hysterectomy, it's because you had too much estrogen and not enough progesterone. There's never, maybe you had cysts on your ovaries, or maybe you had polyps or fibroids in your uterus, or you had endometriosis or whatever, and you had, they took your uterus out. Well, that was because you had imbalance. It was estrogen. Your doctor might not have told you that, but that's what was happening. They forget. Well, first of all, they should explain it to you. But a lot of times they don't remember. All they know is, I see fibroids. Well, doc, why do I have fibroids? Why did I get that? Explain it to me. It's a good question, isn't it? Oh, well, you got too much. Well, they might not even know that. Okay? So, you got it? You know where I'm coming from? You want balance. Diet helps. I have thousands and thousands of women on our hormonal formula. There's a reason I do it. Because I want to block their extra estrogen. Progesterone is wonderful. All these things that are so good for you, and they're natural. See, in the plant kingdom, they have bioidentical hormones. They found that, in the plant kingdom, there was a really good hormones in there. Like they're called bioidentical, which is your body loves. So anyway, that's the kind of hormonal therapy I do. And ladies, you want to be balanced, not only for the protection of your brain, not only for the protection against cancer, but in order for you to feel good. You want to be balanced. Women are complicated, unless you didn't know that. It's complicated. Because if your estrogen is dominant, it affects your thyroid. And the doc says, well, I tested your thyroid. Your thyroid is within normal limits. I know, but you didn't check my estrogen. This is why these things are so important, okay? This is why it's so important. You guys have to take control of your own health. Now, I know I'm preaching to the choir this morning. You're not on here wasting your time because you got nothing else to do, right? You're learning about health. You're learning about how to take care of yourself. I love that. I want to teach that. I get motivated by you guys. I don't like talking to myself. It's not a good conversation usually. But I love talking to you guys because you respond and you're the ones, you're proactive when it comes to your health. And that, I'm telling you, nothing pumps my tires more than that. Now listen, let me just finish with this because I promised it to mention it. Is the IUD considered the same as birth control? Well, it's similar because what they're doing in the IUD is putting progesterone in the IUD, except that it is progesterone made from horse's urine, okay? Not from the plants. They take their progesterone from horse's urine, yeah? And that's why the IUDs, look, again, I'm not telling you ladies, never listen to a man about birth control, okay? Like if you're literally taking, but most women take I guess they do take, a lot of them take the IUD. But IUDs is progesterone. Is it safe? It's probably safer, a little bit, than the birth control pill. But it's a device that's implanted into the uterus. Remember that. A lot of people have trouble with that, okay? A lot of women really have trouble with that, with bleeding and anyway. Look, I don't want to tell you, I'm not telling you what to do, okay? Because ladies, I'm just giving you info, okay? I'm giving you info. You guys are great, okay? Love you guys. Talk to you soon.
You've reached the end of another Doctor is In podcast with your hosts, Dr. Martin Jr. and Sr. Be sure to catch our next episode, and thanks for listening.